So again, some of you who didn't come to the first series, my name is Scott Kennecke. We'll be talking about I didn't mean to do that. We'll be talking about brain spotting. This is a trauma intervention. The main goal of brain spotting is really for discharging trauma. And so we'll talk a little bit about what that means. So I'm the founder of Neuro-Empathic Counseling, and my experience is in trauma, neurofeedback, quantitative electroencephalograph, which is brain maps. We'll talk about some brain maps. I'm kind of thinking that I should have done the brain map presentation prior to this one, but it's okay. I'll be able to we'll be able to figure it out. And then brain spotting. So I am a senior fellow with the Biofeedback Certification International Alliance, which is just a certification for neurofeedback. And essentially, I've been doing that for about 16 years. But for the last 7.5 years, I've been working at a long-term residential facility for complex developmental trauma. So most of the kids that I worked with, they range from about 10 years old up to like 22 years old. A lot of them were adopted. And so they had things like, and we talked about this last week, they had things like generational trauma, PTSD, complex developmental trauma, which is essentially trauma that develops in early childhood. And so I did a lot of brain spotting with this population, a lot of neurofeedback, and a lot of something called DDP, which is dyadic developmental psychotherapy. So those are my expertise. I just kind of go over that. All right, so as the beginning of brain spotting, let's talk about the kind of origins of it. And the origins of it really come from a practitioner by the name of David Grand. So David Grand is the founder of brain spotting, and he trained originally in EMDR. So for some of you, you might not know what EMDR is. It is another type of trauma intervention that helps to discharge trauma. We're not going to talk about that today because I don't have as much experience with EMDR as with brain spotting. But to give you a little bit of background about what EMDR is that it essentially has to do with something called bilateral stimulation. And bilateral stimulation is essentially moving your finger kind of one from left to right and back from right to left. Or in some cases, practitioners will use light bars, that will go back and forth. And so what you're trying to do is you're trying to keep your eyes focused on that light bar as it moves from left to right, creating what's called this bilateral stimulation. And so the idea of this particular intervention is that you're trying to desensitize yourself to some type of traumatic memory. So if there was some type of physical abuse, or let's say you're a firefighter and maybe you lost somebody on the job, or a combatant in your squad experienced incredible amount of loss of life, then EMDR would say, all right, well, let's go back into the memory, let's remember that memory, and let's try to desensitize you to it by using this bilateral stimulation. And so the idea is that when you experience or remember a traumatic memory, it tends to activate the body. It tends to activate the system and kind of shift it into what we call fight, flight, freeze, tend, and befriend. Most of the time with post-traumatic stress, it goes into either a fight or flight response, or I guess a freeze response. Those are the typical responses. So with EMDR, what we're trying to disrupt that normal circuitry. We're trying to disrupt the brain from going into that fight, flight, freeze response, so that kind of the adult mind, the rational mind, can really gain some insight and reorganize, your thoughts about these events. So people, when it comes to trauma, they tend to create what's called a cognitive distortion. And a cognitive distortion is, like a good example of that would be, let's say you were sexually abused, they may kind of consider that to be their own fault. Or if you're a firefighter, that lost somebody in a fire, you might say, well, if I was just better, I would have saved that person's life. And it's usually these particular cognitive distortions that really contribute to a lot of the feelings of activation that we have when we remember those memories, is that somehow it was my fault, or somehow it has to do with how I'm a terrible person, and that's why this event occurred. So David Grand trained as an EMDR practitioner for again, I think about 20 years. But what he discovered is he discovered something called a reflexive response. So as he's kind of sitting there with a client and their eyes are kind of going back from left to right, what he would see is that they would come to a specific point in the visual field, meaning they would come to, center or off center in their kind of eye position. And the eye would either kind of skip over that area or they would kind of shudder, there'd be kind of like a shake, or the person would kind of like dip down or wilt. There was some type of physiological response and it was consistent enough to be predictable. So every time you'd go to that particular spot, you would get some type of reflective response, either being an avoidant response or some type of physiological manifestation of that. And so at that time, his hypothesis was, well, okay, if you're avoiding that particular eye position, then maybe there's something there. Maybe if we kind of go into that eye position and hold it, maybe what we can do is we can get these emotional activations to come out. So he tried it. So he had the person hold their eye position in the area of the visual field that they were avoiding, and he just let them sit there with it. And what he found is that when they sat there with that eye position fixed, that they started to process all sorts of stuff. Things started to bubble up, memories, thoughts, feelings, emotions, sensations, all of these things just kind of started to come to the surface. All of the things that this person had been emotionally suppressing were emerging. So again, as he's discovering this is kind of like, all right, am I doing the right thing here? So he checked in with them, and what he discovered is that when people were able to allow all of this kind of stuff to come to the surface, that it allowed them to be able to kind of go into that memory again without experiencing that activation or without experiencing that emotional reactivity. So this was the birth of brain spotting. So we'll go into the elements here, the elements of brain spotting. So the first thing is where you look affects how you feel. So the best way to describe this is if you're ever having a conversation with someone and you notice, I mean, if you guys can see me, I don't know if you could see me, but you might even notice like my eyes kind of going up into the left corner, or my eyes might be going down when I'm trying to remember something specific. So next time you're in a conversation with someone, just kind of watch their eyes. And what you'll notice is that their eyes will go into particular locations when they're trying to remember something. So this becomes really important for developmental trauma or PTSD or even generational trauma when we're trying to access either implicit memories or more conscious memories. So we know that if we can find a particular spot in your visual field, we can gain access to memory better. And so this becomes useful when we want people to go towards their activations rather than avoid their activations. Okay, so the next thing is focus mindfulness with focused activation. So this goes into the idea of emotional suppression, disconnection from body. So a lot of times the defenses, and we talked about this last week related to trauma, that really trauma is survival brain, and survival brain is really about activating certain defense structures to protect you. Emotional suppression, disconnection from body, disassociation, distractibility, all of those are particular defenses that we utilize to not feel things. So with brain spotting, what we're trying to do is we're actually trying to go towards that thing that you've been avoiding. So it's kind of like the joke that I have for therapists, and why I think therapists get a bad rap is that essentially what we're saying to people is we're saying, hey, all that stuff you've been trying to avoid and not think about, well, why don't you come hang out for an hour and let's talk about just that. So with focus mindfulness and focus activation, really what we're trying to do is we're trying to do the opposite of your defense systems. We're not trying to protect you anymore. What we're trying to do is we're trying to explore, we're trying to understand, and we're trying to activate internal healing mechanisms that are inherent within your nervous system around these particular emotional defense structures, like emotional suppression. So in the trauma world, we call these trauma capsules. And trauma capsules are essentially when we experience something traumatic, we create what's called a traumatic implicit memory. And these implicit memories inform our perceptions about how to navigate the world. So to give you an example, if you're an infant and you're crying and your caregiver comes in and just smacks you and says, "Stop crying," you learn very quickly that crying is associated with pain. And so neurobiologically, you create this traumatic implicit memory because, again, you don't have any visual information, you don't have any auditory information. So you're encoding memory on a very nonverbal level. You associate crying with pain, or on an even deeper level, crying with not surviving. Okay. So now you have this traumatic implicit memory that's locked and loaded in the body, and now it informs your perceptions about how to navigate the world, how to survive. So again, what we're trying to do is we're trying to go towards that. We're trying to understand that. We're trying to develop a mindfulness about that, and then we're trying to intensify the activation. Okay. The third element is something called limbic resonance and oxytocin system. So the limbic resonance is just kind of like a really fancy way of saying like empathy, or we talked a little bit about interpersonal neurobiology last week, which is to say that's a fancy way for saying that we affect each other emotionally. So if I were to go into a room of people and they're all anxious and they're all hyper or something like that, there's a strong possibility that I am going to get anxious and I'm going to get hyper because we affect each other emotionally, especially in groups. Now, if you talk to an evolutionary psychologist, they might say that really interpersonal neurobiology is really useful because it allows us to communicate non-verbally. So if I go into a situation and everyone's anxious, well, that might be informative. It might be that there's something threatening. There might be that there's some, maybe someone is attacking the group, or maybe there's a threat. And so if everyone's kind of their anxiety makes me anxious, then I can prepare myself for some type of engagement. Now, the other side of this, the more intentional, the higher order system here is empathy, which is to say that we can feel each other's emotions. So if you're kind of sitting there and you're talking about something sad, I can sit with you and I can experience that sadness. Now, I'm going to have to probably draw on something of my own. I'm going to have to draw on my own sadness, but I can experience sadness with you. So limbic resonance is really that concept. And what limbic resonance is I'm sitting with you, I'm attuning with you, I'm feeling your emotions as you experience your emotions. I'm providing acceptance around that. So what we're trying to do is we're trying to activate a system called the oxytocin system. And some of you have maybe heard of this, but the oxytocin system has to do with attachment or attunement. So a mother, when she births her child, will release oxytocin, and that oxytocin will imprint on the child. And so now the mother has a strong bond towards a child. And in some cases, if a mother doesn't release oxytocin, then it's a lot more difficult for them to develop a connection to their child. So oxytocin is really about attachment to other human beings. I imagine probably other animals too. I feel very attached to my dogs, as probably a lot of you feel as well. But oxytocin is also going to be released in like a hug or a safe touch. Those types of things are going to impact oxytocin. Now, so essentially what we're trying to do with the oxytocin release is we're trying to modulate pain. So there's two types of pain in the psychological world. There's something called nociceptive pain. And nociceptive pain is basically pain that comes from the body. So if I take a hammer and I hit you on the side of the shoulder and you feel the pressure and the pain of that, that contact, then that's nociceptive pain. That's pain that's coming from the shoulder. It's going up the peripheral nervous system into the central nervous system and saying, hey, Scott just hit me with a hammer and that really hurts. Psychological pain, on the other hand, is going to be emotions. So things like I'm not good enough, or I'm not lovable, or everyone at school hates me, or no one understands me. These types of thoughts, these types of implicit memories, these types of emotions and activations that come up. So the reason this becomes important is because the oxytocin system, when you get a hug or when you feel connected to someone, when you feel understood, when you feel loved, What that does is that actually modulates both the nociceptive pain and the psychological pain. So it's kind of your quintessential, the mom who kisses the child's knee when they scrape it is actually helping that child to feel less pain because of that oxytocin system. So the reason this becomes useful is essentially that a lot of times with trauma, what happens is people will disconnect themselves from their body, their nociceptive pain. So if you know someone with trauma, there's a strong possibility that they have a very high pain threshold. I mean, when in the trauma world, when I was working at the facility, you'd ask a student, what's your pain threshold? Oh, I don't really feel pain. Some of the kids that were self-harmers, they barely felt pain. So what you're trying to do here is with the oxytocin and limbic resonance, is you're trying to modulate that system. Okay, next. Okay, so a little bit of philosophy about brain spotting. So with brain spotting, and this is maybe some of the reasons why some people have some resistance towards brain spotting, is that essentially what we're asking you to do is go into the storm. So instead of avoiding and disconnecting and distracting, actually what I want you to do is I want you to go into the storm. I want you to sit with your activations. I want you to sit with your feelings of unworthiness or betrayal or your feelings of fear and panic related to some type of event. So the reason I have a bison on here is because they're a really good metaphor because when storms start to brew, the bison tend to mobilize towards the storm. And so the kind of the theory here is that if I can go towards the storm, then I can weather it quicker because I can get through it versus trying to avoid it and kind of delaying it and maybe even getting stuck in it even longer. So when it comes to trauma and discharging trauma, it's really about facing it, going towards it, and allowing yourself to really just traverse that as quickly as you can versus kind of avoiding it. Okay. All right, so you might ask yourself, well, how does this really heal trauma? How does this discharge? So we're going to start with emotional release. So emotional release is this concept that when we start to really pay attention to, we become mindful of, and we activate the system, that the body will release that particular emotion. So earlier I talked about the trauma capsules, and SUDS is basically the subjective units of distress. So how much pain you experience. So emotional release is something that in most cases is necessary in order to really release that implicit memory. So I'm going to show you a video here and I'll set it up because it really helps to illustrate what emotional release looks like. So I'll set it up, I'll explain it, and then we'll watch this video. So the video is of a polar bear, and the polar bear just is being chased by some helicopters, and the guys in the helicopters shoot it with a tranquilizer dart. And then it's a bunch of humans basically surrounding this polar bear. And what they record is that they record the polar bear kind of going into these like undulations, like it's going through this, it almost looks like it's having a seizure. And so what's happening to this polar bear is that essentially it's releasing this trauma. It's an apex predator. It's, kind of subjectively, it's probably feeling as though it's dying, but it's still conscious. So it's an incredibly traumatic event for the polar bear. And so what you'll see is you'll see it go through the process of releasing trauma. And interestingly enough, animals are a lot better at releasing trauma than humans. Humans usually require a lot more complexity to release trauma than animals. So let me pull that up real quick. Okay. Oh, here it is. Okay, so let me get to it. So here you're kind of seeing I'm sorry for the quality. I couldn't find a good quality here, but so you're going to just kind of have to maybe use a little bit of imagination. But you see the dart going in, you see the bear being chased here by the helicopter. Okay, so it gets shot. Okay, now again, you have all the humans kind of surrounding it.
Hey, Scott, we just have your
Yeah.
desktop. We don't have your screen yet.
Oh, sorry. Thank you.
I thought those were some really abstract bears.
Can you see it now?
Yeah.
Okay. So I'll back up here. Okay. All right, again, so we're seeing the helicopter kind of chasing this bear. All right, so now you've got all the humans kind of around it. Again, you can see that the bear's eyes are open, so it's still conscious here. So this has got to be a terrifying experience. Okay, so they're kind of moving this bear. And then it starts, here we go. We start to see this kind of undulation. You can see how it almost looks like it's going through a seizure. And so the language here is that there's a release of an extreme amount of energy. Okay, so there is this kind of energetic release, like basically the electricity and muscle structures. People will experience kind of like these electrical charges of their spine. And then notice here, it's the polar bear is starting to relax. It's starting to breathe. Here, I'm going to go back because I want you to see that. It's relaxing here. You can see deep breaths over here. Great. Okay, so you might say, well, all right, Scott, that's a polar bear. Like, all right, but do humans really do that? So I do have an example of this individual. This is a Navy SEAL. His name is Micah Vega. And basically this experience is this guy is talking about an experience that he had where his squad was, everyone lost their life. He was the sole survivor. PTSD, couldn't sleep, lots of, a lot of kind of traditional responses here. But here we get to see him going through the process that we just saw the polar bear go through. So again, you can see kind of the undulation, you can see the body kind of going through these waves. Yeah, there's almost kind of like a vomiting feeling or kind of look to it. And again, I think he does it again over here. Right. Okay. So just as a note, I want to note that not everybody experiences that particular type of emotional release. Sometimes the emotional, let's see, from current slide, here we go. And can you still see my desktop? Because maybe, can you see my desktop? Give me some feedback here.
Yes.
Okay.
Or, no, I'm sorry. We see your slides.
Okay. Perfect. Okay. So in some cases, when people do emotional releases, it doesn't always look like that. Sometimes it can be, I mean, everybody typically is different. To give you some examples, sometimes people will go into a deep silence to the point where, I've tried to talk to them in the session, and later I'll ask them, and they'll completely ignore me. And later, I'll ask them like, I'd asked you a bunch of questions. Were you even able to hear me? And they'll say, no, I didn't even know that you were speaking to me. Whereas other people, when they do emotional release, they might go into hysterical laughter. I've had experiences where people are just laughing hysterically, and sometimes what they'll do is they'll kind of oscillate back and forth. They'll go from a hysterical laughter into crying, and so they're laughing and crying at the same time. And people will say, is that normal? Like, is it normal for me to both be crying and laughing at the same time? And my response to that is, well, I've seen it before, so I guess so. I guess that's a thing. I guess that people go through that. Some people will get angry and punch things. Time and time again, I often make this comment where I say, like, if I feel like someone is going to punch me in a brain spotting session, that's a good sign. I've never been punched, but if I'm sitting there and I'm with someone and they're experiencing an intense amount of anger and I kind of have that fear, usually now at this point in my life, I think of that as a really good sign, because the person is really connecting with that anger. And connecting with anger is really important for people who have, been bullied, or, people who have been gaslighted and, have not really respected their own boundaries through time. So really connecting with anger can be incredibly, incredibly important for emotional release. Okay, so the next kind of component for the healing is that oxytocin release that we talked about earlier. So the oxytocin release is really going to be about that feeling, that felt sense of connection, and really what you're trying to do is create a sense of safety. So I'm not going to release my trauma around you if I don't feel, one, like I feel safe, and then two, that you as a practitioner are able to really handle my emotional release. And that's a big part of the process. So, if you guys are now, anyone out there is considering going and doing a brain spotting session, you want to make sure that the person that you're doing it with, the criteria is, one, that you feel comfortable with them, like you have a connection with them, because really doing trauma release should never be done alone. And it shouldn't be done alone for two reasons. One, because it really sets you up for potentially engaging in a defense, like distracting yourself or disassociating or, something of that nature. But then also because of this component here, this oxytocin release, which is to say that it's easier to go into trauma when you feel safe and your pain is modulated. So if I feel like I'm not going to experience as much pain, then it's going to be easier for me to release this. So just as again another side note with the practitioners, it's also very important that the practitioner has done their own work, because the worst case scenario is something called countertransference, which is essentially as you are releasing your trauma, you are now triggering your practitioner, and they are now dealing with their trauma, which is just a terrible situation. So again, make sure that if you're picking a practitioner, that you feel connected to them and that you have a sense that they are also healthy. All right, so the oscillation in the autonomic nervous system. So the autonomic nervous system is essentially the part of the central nervous system that is like our gas and our brakes. So we divide it into something called the parasympathetic nervous system, which is like when we feel calm and we feel relaxed and we feel good, or maybe if we feel unmotivated, that's all going to be the parasympathetic part of the nervous system. And then the sympathetic nervous system is going to be a part of the nervous system that is our gas, our like mobilization, when we feel anxious and we feel motivated and we feel ready to go. So what's interesting about brain spotting is a lot of times people will oscillate back and forth between these two different states. So they'll get super angry and, again, I'll feel like I'm going to get punched, or, they're just maybe hitting the chair or something like that. And then they'll kind of shift into this moment of just kind of taking breaths, like, and relaxing. And they'll think things through. And that part of the brain that really is what I call the adult brain, that comes in and really kind of destroys or deconstructs these cognitive distortions. This is where people are able to identify, it actually wasn't my fault, or I didn't have any control over that situation, so I should stop blaming myself. It's when those particular narratives can come in and begin to really integrate into the system and really kind of heal that part of the brain or the body that really still feels like a victim, or still feels, fear because, I lost my entire squad. So this oscillation of going back and forth becomes a critical part of trauma release, and also integration and really desensitizing ourselves to a traumatic event or complex developmental trauma. So what typically will happen in a brain spotting session is the anger will emerge, then they go into a more parasympathetic response where they're breathing and they're thinking through things, and then something will trigger them again and they'll go back into that anger. But the second time they go into the anger, it's less intense. And so the idea is that you just continue the brain spotting session until the intensity of that sympathetic response is zero. And again, that's the whole point, the full discharge of that emotional trauma. All right, the last thing I want to talk about is kind of the elephant principle. Some of you guys have probably seen this on like social media, but it's really about learned helplessness and insight. And the idea here is that animal trainers, and actually, to be honest, I'm not sure if this is 100% true, but I've heard it so many times and it's a great metaphor. But elephant trainers, what they do is when, you have an elephant and it's really young, what they do is they kind of put a stake in the ground and they attach a chain to the stake and they attach that chain to the elephant. And the idea here is that as a young elephant, it can't pull the stake out of the ground. It doesn't have the strength to be able to do that. So what it does is it learns this helplessness. It learns that it doesn't have the capacity, it doesn't have the ability to pull this stake out of the ground. And so as it grows and becomes a larger elephant, essentially it never questions that stake again. It's learned that it doesn't have the strength to be able to pull that. So this also happens in humans. So let's take the example of that infant. The infant is crying, and the caregiver comes in and slaps the child and says, you know, don't cry. The child learns not to cry, and so fast forward 20 or 30 years later, this adult believes that it can't cry, it can't release, it can't show weakness, it can't show its emotion because it has this implicit memory, this learned helplessness, that if it cries, it's going to experience pain. Now, the other side of this too is that with an infant, when you develop that implicit memory, there is a connection to its survival. So you're an infant, you don't have the ability to feed yourself. And so literally, if you disturb your caregiver in some way, that on a very physiological level means death. So fast forward 20 or 30 years later, and now, you know, I'm a Brainspotting practitioner and I've got you in my chair and I'm asking you to face these particular implicit memories. And so in a way, it feels like we're going to face something that's going to result in my death. It becomes that intense. It becomes that kind of activating. So, but the point here is that the reality is that you're not going to die. Actually, as an adult, you have a stronger capacity to manage the emotions and activations that you felt as an infant. So as you start to do the brain spotting sessions, the insight that you gain is, oh, I'm stronger, I'm more capable, I have more capacity now. I no longer need that particular implicit memory for survival, and I can let go of it. Now, let me make a note here, because one of the beautiful things about brain spotting is that as a practitioner, I'm not really kind of poking and prodding and helping and reframing. I'm not really doing a lot of that. It's actually one of the reasons that I really enjoy brain spotting, is because I can sit back as a practitioner and I can tell you all sorts of wonderful insights, and I can tell you, you know, all sorts of analytical things that I've learned about you over time. But until you come to that conclusion yourself, no amount of me providing you with advice or information is really going to impact that. So what's great about brain spotting is that the nervous system tends to, when it goes into that focused mindfulness and that focused activation, it tends to take the route that's most efficient for itself. Because the brain itself is, I mean, there's, I don't know, it's like trillions of connections. So for me as a practitioner to even think, sorry, I just heard a sound. Is there a problem or is there an issue, or should I continue? Everything good? Okay,
Yeah,
I'm going to
good.
assume everything's good. Okay, so for me as a practitioner to assume that I know the right path for you is a little bit presumptuous. So for me to kind of, my job is really just to set the conditions for you so that your nervous system can go through its process that it needs to go through in order to discharge that trauma. Okay, let's go next. All right, so I'm going to go through just kind of the logistics here. And the logistics of a brain spotting session. So let's say, okay, you're inspired now and you want to go try a brain spotting session for yourself. All right, so what's going to happen is you're going to sit down with a practitioner, and the first thing that you're going to do is you're going to do something called filtering or funneling the activation. So what is the memory? What is the event? What is the series of events that happened in your life that really just gets you the most? And what by get you means that when you think about those things, they activate you in either some emotion like sadness or anger or shame or something of that nature. So a lot of activating kind of memories would be some of the things that I've already talked about, you know, feelings of abandonment, feelings of not being loved, being betrayed by your best friend, being betrayed by your husband or wife, um, grief or loss, these types of things. You're really going to want to find the one thing that is the most activating in you. And really the conversation is really about that. And so again, if you're going to go there, the question that I would ask, or I would have you ask yourself, is what memory or what emotion that I experience most of the time that if I could not have that anymore would make my life better. And so that particular emotion, that particular memory, that's what you'd want to bring to the practitioner. Okay, so you identified the activation, which is really looking at the emotion. And this again can become very, very subjective. I've had kids say, the activation is blah. I said, all right, well, let's monitor this feeling of blah. Or the activation is just a sound, or the activation is just some random word like just stupid, So it's very, very important that when you're identifying what the word is around the activation, that it becomes very, very subjective to the person. The third step is plugging into the body. So every emotion that we experience, every activation that we have is felt somewhere in the body. So if you're feeling unloved, it could literally be in the heart. If you're feeling fear, it could be in the stomach, like when you get butterflies, or people who, have irritable bowel syndrome when they get nervous. Sometimes when people feel anger, they feel it in their arms, or they feel it in their shoulders. Sometimes people feel, judgment in their head, and it's very different for most people. Now, this can be really difficult for people who have complex developmental trauma or some type of physical trauma, because really gaining access to the body is really going to activate them very intensely. And then also one of their defense structures is a disconnection from the body. So more often than not, when you have someone who's experienced sexual trauma or something like that, they don't really feel their body. They're just shut off from it. So there are some contingencies that you can do. There's something called alpha stim, which we'll talk about later. Heart rate variability, we'll talk about later. Something called TCTSY, which is trauma sensitive yoga. So there's different yoga practices that help you to reconnect with your body. There's all sorts of different interventions that you can use prior to a brain spotting session to really help the person identify where their activation is coming from in their physiology. Okay, so then after you kind of plug in, so if I was kind of working with someone, I would say, all right, I want you to find the activation. Okay, it's shame, or I feel betrayed, or I feel scared. I would say, okay, where do you feel that in your body? Okay, I feel that in my heart, or I feel that in my stomach, feel that in my legs. And then the next part is really, actually, before we go into measuring, at this point, we're going to try to find an eye position. And so actually, I'm going to stop sharing my screen for a second, and I'm going to show you kind of the tool that we use in brain spotting. So we use this pointer. Pointers will come in different variations and sizes. But what's happening here is that I'm going to ask you to identify your activation, identify where you're feeling it in your body, and then we're going to move the pointer. Again, we're trying to access that memory to different locations. It might go up, or it might go down. What we're going to do is we're going to try to identify when that activation is the most intense. And we do this two ways. One, I might just ask you. I might just say, when do you feel it the most? These are people that do have a sensitivity to their body. For people who don't have a sensitivity to their body, what I'm going to do as a practitioner is I'm going to look for a reflexive response. So if I go here, and at that point you kind of you shiver, then I might say, okay, well, this is a good spot. Or if I go here and you kind of blink and your head goes back, again, I'm looking for these reflexive responses that may be indications of some type of traumatic memory located at this particular spot. Okay, and again, we're trying to go for the focused activation. I want you to go towards the storm, not away from it. Okay. All right, so at that point, we're going to measure the intensity. How intense is that activation from 1 to 10? 10 being that, you're about to have a panic attack, to 1 that like you can barely feel it and it's not really happening. And the reason we do this is because a brain spotting session is about discharging the trauma completely. We want to get it to the point where when you focus in on that anger, you focus in on that depression or that sadness, that eventually at the end of the session that you're no longer feeling that emotion, and actually you can think of the memory and you can't even feel the emotion connected to it. So we're trying to get to a SUDS level 0. Okay. All right. Okay, so I'm going to take you guys through a couple case studies. I might just take you through one just based on time, but in order to understand these case studies, it's going to be really important that you have a little bit of understanding of the brain map. And actually next webinar, we're going to go really into depth into these brain maps. But today, for our purposes, I'm going to keep it a little bit surface, just so you can kind of understand the comparisons, because I'm going to show you some data. And it's going to be really important to understand the data a little bit. All right, so brain maps. What we're doing with brain maps is we're recording the EEG, which is the electrical activity of the brain. This is something that you would do if you were to go do a sleep study. So if anyone out there has gone to get a sleep study, they're going to put an EEG on your head. They're going to measure your brain waves while you're sleeping. Or if you have any kind of thought or fear of like epilepsy, they're going to measure your brainwave and see if there's any ictal activity, any spike wave activity in the brain that may indicate that you have epilepsy or seizures or something like that. So I'm using a qEEG, which stands for quantitative electroencephalograph. Quantitative means multiple points. Electro is electricity, encephal is brain, and graph is picture. So it's literally just an electric brain picture. And so what I do with these is that I compare them to a normative database. And a normative database is essentially, someone went out there and recorded about 1,400 brains, divided it up into different developmental stages. So an infant's brain is going to look a lot different than an adult's brain. And then they established a norm value, a standard. So what does an infant's brain look like based on 200 scans? What's the average? Or what does an adult's brain look like based on age and gender, an average? And so what happens is I can do a recording on you, and then I can submit it to the database, and I can see how your brain differs from your peers. So compared to your peers, how does your brain differ? And it differs in a couple ways. So here you're seeing the full brain map report. For our purposes, really the top line is going to be the most important. So we're just at the very top where it says absolute power. And then also down here at the bottom, you're going to see a bunch of lines. That's going to be important too. So the top line is really going to be any coloration is going to be an indication of a deviation, meaning that compared to your peers, it is different. Okay, now not all differences are going to be negative. Emotional intelligence, intellectual intelligence, music performance, I don't know, all sorts of things like that are all considered deviations. If you're really good at something, you are not the norm. So we do pick up on these kind of neurological adaptations and or just, positive deviations. Most of the time when I'm doing qEEG scans, I'm working with people who have mental health conditions. And so most of the time when we see deviations, those deviations are going to be connected to defense systems or to symptoms. So it might be I'm picking up on depression, or I'm picking up on anxiety, or I'm picking up on disconnection from body. Okay, so all you need to know is that the coloration is going to be an indication of symptom. Again, I'm overgeneralizing here. So if you see this yellow, that's an indication of symptom. If you see this blue or green, that's an indication of symptom. And the severity or the saturation of the color is going to be an indication of the severity. So if you see this kind of dark orange here, that means that it's more severe than if it's a light yellow or light green. The more saturation the color, the more severe the symptom. Okay. So last thing down here, you see a bunch of lines. And again, I'm just going to generally speak about this. It means that there's problems with the connectivity of the brain. So the brain is not communicating very well. And when the brain doesn't communicate very well, that essentially means that there's going to be an inefficiency, and that can cause symptoms as well. Okay. Next. So we're going to talk about case one. So case one, this is a client that I worked with. She was a young woman, 16, 17. She was adopted. So with adoption, especially with complex developmental trauma, a lot of times you get things called the primal wound, which is the separation from the mother, can cause a sense of abandonment, biologically speaking. And so that can create a sense of lack of self-worth. Generational trauma. So, my parents, they had addiction problems and their own trauma. And really, she had a felt sense of abandonment and unworthiness. So there was a lot of unworthiness, a lot of I'm not lovable, and nobody wants me. Those were a lot of kind of the activations that she was expressing. She engaged in risky behaviors. She developed unhealthy relationships and was in constant power struggle with her caregivers. There was a lot of aggression and violence between her caregivers and herself. And then often when clients develop the unhealthy relationships, it can result in a sexual or physical abuse. I'm going to be a little bit vague about her particular trauma here, just as kind of just kind of protecting her. But there was sexual abuse and there was physical abuse in her past related to some unhealthy relationships that she found herself in. Okay, so her goals were really, overcoming anger and rage. She had a lot of anger, a lot of rage, very violent, attacking other people, attacking other kids, peers, very dominant personality. That was kind of the go-to. She wanted to uncover suppressed memories. There were memories in the past that she couldn't really remember and didn't have access to anymore. And when we suppress emotions and we suppress memories like that, we essentially cut ourselves off from a part of ourselves. And when we cut ourselves off from a part of ourself, one, we don't have access to our full brain, but it really means that we're cutting ourselves off from other parts of ourselves. So to give you a quick example here, if I cut myself off from my pain, in a lot of cases, the brain doesn't distinguish between good and bad sensations that come from the body. So what happens is if I cut myself off from my body, I also cut myself off from the positive experiences that I can feel. So I just experience this kind of a numbness. So when I talked to this young woman, there was this kind of numbness related to her body, a disconnection from her body. So she also wanted to develop healthy relationships because she'd experienced a lot of unhealthy relationships that were both physically and sexually abusive. Okay. So here we go. Again, this is why I wanted to go into the brain map a little bit with you to understand kind of the differences here. But you're just going to kind of have to trust me for right now in terms of what all this means. But let's start with this first recording. So what I did here is I recorded a qEEG prior to doing Brainspotting. Okay, so before we even stepped into the Brainspotting arena and we started talking about activations and we started talking about all that kind of stuff, I did a recording on her brain. So this was kind of her default state over here on the left side. Now, again, earlier I had said the saturation of color is going to be an indication of severity. So here you can see this really deep blue. So a lot of times when people show this deep blue like this, they're not producing a lot of this frequency compared to their peers. It usually means emotional suppression, which is to say there's a memory or there's a part of myself that I don't really want to remember. I don't want to connect with that. I don't want to think about that. And actually, if you ask me about it, I probably will tell you that I don't know. I just don't remember. Okay. Anything that's white is just considered normal or average. So we've got a little bit of light blue here, a little bit of light blue there, and then we've got some kind of green over here. And again, we're really just going to focus on this top line here. So again, we go, we do a couple brain spotting sessions. We're looking at probably about 3 or 4 brain spotting sessions. We do another qEEG. So a couple things happen here. One, that dark blue becomes less. The reason for that is because she's beginning to identify some past memories that she had suppressed, that she'd forgotten. She started to remember those things. They were incredibly painful memories, which is usually a good reason to not remember them. Incredibly painful memories. She's starting to remember them. So as a result, over here, we see this red. Red, again, saturation is going to be an indication of severity. So we're seeing this really pronounced red here. What this is an indication of is anxiety. Imagine that as you start to connect with some past memories that you avoid and you don't want to think about, you might experience some anxiety. So that's exactly what happened with this girl, is that she started to feel a bunch of anxiety. She started to feel overwhelmed. A lot of fight-flight responses were kind of activating through this whole process. So yes, as you start to uncover some of these past repressed memories, anxiety will come up. Okay, so we do some more brain spotting sessions. So here's the one we just looked like, and then here is the new one. Okay, so a couple more brain spotting sessions. So a couple things that we're seeing. One is that now this delta has gone the opposite way. We're seeing a lot of delta, which actually is pretty typical when it comes to integration and reprocessing. The brain doesn't know what's quote unquote normal, so sometimes it overreaches. It kind of has a pendulum effect. But we're also seeing that this high beta, this anxiety is dropping down. So she's becoming less anxious, she's ruminating less, she's worried less, she's less in hypervigilance state. Overall, she's able to experience these repressed emotions in this delta frequency. She's able to navigate them pretty easily. But now we're seeing this elevation of alpha. And this elevation of alpha is, again, another defense. So as I'm kind of experiencing these things, anxiety, now I'm shifting into disconnection of body. Okay. Side note, not all releasing trauma is linear. Sometimes it goes in all sorts of wonderful directions. All right, so here, we do a couple more brain spotting sessions. So here is the one we just looked like, and this is the most recent. So the high beta frequency is normalizing, anxiety is normalizing, suppressed emotions are normalizing, and even connection to body is beginning to normalize. What was awesome about this particular case was when I first started doing the brain spotting sessions with her, the session was like 2.5 hours. And most of the session was silent. The last brain spotting session that I did with her was about 30 minutes. And I, as the practitioner, did very little. And she was able to find her activation. She was able to find her spot. And actually, she did pretty much the majority of the work. I was just kind of like a prop at that point. I was just the guy holding the pointer, and she just went into it. She experienced, whatever activation she was experiencing at that point. She processed through it. She released it, and then it was done. And she did it in about 30 minutes. So what's awesome about this is as you start to process quicker and quicker, as you start to engage in this process, you're able to manage your emotional regulation way better. Okay, so we do a couple more brain spotting sessions, and then this is the result over here on the right. You can see that pretty much we're at normal. White, again, is normal. So this girl was able to normalize her nervous system through the release of her trauma. She now, when she thinks about her past experiences, it doesn't activate her. It doesn't bring her to a state of panic. The aggression decreased considerably. The relationship that she was having with her caregivers improved. She was able to gain insight into herself and also have empathy for her parents, experience positive regard, so her parents could provide her with love and care, and she was able to receive that. So again, all sorts of wonderful things happen when her nervous system normalized like this. So you might say, okay, well, all right, does this stick? Is this a long-term thing? Is this something that is going to last? So we were fortunate enough to be able to get another scan on her about a year later. So that scan looks like this. Okay, so here we do have some increases in the alpha and the beta, but that high beta and that delta frequency have remained normalized. So this girl, she was still struggling. I mean, she was a teenager, so she had all sorts of, anybody who knows teenage girls knows that there's usually a lot of, dysregulation they're experiencing just on average. And it looks like this particular defense structure, which is this disconnection from body, is still present. So that's just an area that she can continue to work. But again, the emotional trauma, the suppression, all of that is pretty much resolved. So this is a great case. I'm noticing it's 11:55. I do have another case, but we do not have time for that. And I'd like to maybe take a couple questions. So I'd like to stop for a second and go ahead and just open up the chat for anyone who just has like a burning question in their mind that maybe I can get to in the last 5 minutes here. Plus I need a drink, so.
I have a question.
Yeah, please.
Hi, Scott. This is Chelsea, by the way.
Oh, hey, Chelsea.
It's nice
work
to
with
see
Chelsea.
you.
I still use your video of your qEEG. Anyway, go ahead.
So I wanted to ask about the last scan on the teenager you were showing us the year later. Were you
Yeah.
doing any kind of therapy with her when you got that scan, or did you just hook her up and check her brain?
Yep, just hooked her up and checked her brain. We just wanted to see what happened a year later. That was it. No intervention was
Awesome.
used.
Okay, awesome.
Yep.
Nice to talk to you.
Nice. All right, so we've got 2 questions here. See what this says. What was the feedback from the girls' caregivers or behavioral changes? Oh, the family was elated. Typically, when you as a practitioner can help a child kind of process through their trauma, and usually what that results is that the child can be more receptive to the parents. The aggression had completely dissipated. I mean, normal aggression, normal arguments that again a teenage girl would have with her caregivers. But it wasn't violent. It wasn't aggressive. The caregivers no longer had that fear of harm because when you're interacting with someone who is emotionally dysregulated like that, typically it creates trauma in the caregivers. There's a traumatic reaction in that. So they were elated. Just and I actually keep up with this particular client. I saw her like a couple months ago, and she has just amazing things. Just talks about how much respect she has for her parents. It's just great. Okay, so we got a couple. What's going on here? Also, when looking for, I'm not sure where to go. Have you seen any trends in being able to overcome trauma better at a younger age compared to older patients? No, actually. That is a great question, and I think that people would assume that older people tend to have a harder time with discharging trauma. And that hasn't been the case. I've worked with people in their 60s and 70s, and they have discharged trauma just in amazing ways. Again, my reaction is I always feel honored that people are willing to discharge trauma in front of me because it's not a pretty experience. People tend to be very self-critical and self-judgmental when they go through that. I mean, I've done my own work, and you tend to ugly cry, and you're got snot all over your face, and there's a bunch of stuff that happens there. So no, I haven't seen that. And in neurofeedback, that's different because in neurofeedback, actually, children are a lot easier to work with than adults. But we'll get to that next week. But no. All right, how effective is the treatment with neurodivergent individuals? Oh yeah, so I've worked with that community as well, and they are just as capable of discharging trauma as well. Because again, like what you're really trying to do is you're not really trying to control them, you're not really trying to instruct, you're just trying to set the conditions for them to really connect with and discharge your own trauma. And in some cases, neurodivergent communities are better because they kind of have this analytical like perspective, like almost like this third person objective evaluation of their activations. They have like a little separation. Quite recently, in the past week, I worked with a kid who had been bullied like for the past 2 years, cyberbullying, TikTok, and all this stuff, just really, really terrible. And I worked with him. He was able to connect with his anger because he wasn't a very angry kid. And then, okay, and this is maybe a little bit controversial, but I'm actually very proud of him for this. But the other day he was getting bullied. A kid had pulled off his shoe and was hitting him on the back of the head with a shoe. And he turned around and punched that kid in the face. And so for me, he didn't get any trouble. The teacher understood, the principal understood. For me, that's an expression of what I describe as healthy anger. And healthy anger is a defense response. If someone is attacking you, anger is designed to protect you. So respond by defending yourself. And so I was able to talk to his father, and his father was saying the same thing because he was worried that his father was going to be mad at him because he had done violence on another kid, and his father was incredibly proud because he really set a boundary. And so connecting with your emotions and connecting with these activations really allow you to engage with healthy interactions like that. Yeah, so I am available for Converge team members for remote sessions. So if you guys are interested in doing some brain spotting sessions with me, please contact me and we can set that up. Absolutely. Okay, well, we're at the 12, or I guess for you guys, it's 1 o'clock. So I look forward to seeing you guys next week. We're going to talk about neurofeedback and brain scans and training the brain.
Scott,
So thank you,
I
everyone.
think we missed one question, if you don't mind, really
Oh,
quick.
Sure.
Has there been any link between trauma and other conditions such as restless leg syndrome?
That's a good question. I can't say for sure, but I do know that when someone has trauma, that they do experience physiological manifestations of that. So people who have irritable bowel syndrome, or they have autoimmune, or people who develop cancer, and really that's a correlation. So the appropriate way to describe that would be a correlation. So people who have trauma tend to have a higher correlation of disease in general. Hopefully that gets at it. I can't answer that directly, but yeah.
Thank you very
All right. Well,
much.
thank you guys. I will see you next week. It's always a pleasure.
Sounds good. Bye.
Bye.